Ladies and gentlemen, our guest speaker, Dr. Olajuwon Alabi. Dr. Olajuwon Alabi is the current president of AGES. He was elected into office in September 2021 as the second president of the association. He had initially served as the vice president for 4 years. He is the CEO and medical director of South Shore Women's and Children's Hospital. He is a specialist obstetrician and gynecologist and a member of the Royal College of Obstetricians and Gynecologists, United Kingdom. He is an expert in advanced gynecological endoscopic surgery, minimally invasive surgery, and one of the leading experts in the field in Nigeria. His other areas of interest are fibroid treatment, infertility and assisted reproductive techniques, endometriosis diagnosis and treatment, high-risk pregnancy care, and recurrent miscarriage. Ladies and gentlemen, please welcome to Fertility Conference 2023, Dr. Olajuwon Alabi. We celebrate you.
My name is Dr. Olajuwon Alabi. I'm a consultant gynecologist and also the founder and CEO of the South Shore Women's and Children's Hospital, both at Victoria Island and Ikeja GRA. We have actually been running for about 11 years now. We started 2012. And one of the main things we deal with is we deal with a lot of fibroids issues. So my background is that I trained in the UK and then relocated back to Nigeria, and I've been practicing in Nigeria. The reason I see a lot of women with fibroid is that I have the skill not only to do the routine fibroid surgery, which is called an open myomectomy, but I can also do something called laparoscopy and hysteroscopic myomectomies. Those are removing fibroids, sometimes without cutting people, and sometimes using tiny cuts and fibroid treatment has also evolved into doing robotic surgery, which we're hoping that we'll be able to introduce in the future. So what exactly are fibroids and why is it such a big issue in this part of the world? Firstly, fibroids are growth in the wall of the womb, which we don't know the reason why it happens, but it's very common in Black people. Not that it doesn't happen in white people as well, but extremely commoner in Black people. And also, it seems a bit more aggressive in Black people as well, especially of African origin, women of African origin. And there are different types of fibroid, and it affects people very differently. So how many people do have fibroid? A lot of people actually have fibroid. It's almost like 40 to 70% of women in reproductive age group have fibroid. I'm sure you can imagine. So I'm saying 4 to 7 of 10 people who are trying to conceive in this part of the world will have fibroid. But not all fibroids are big, and not all fibroids affect women. Some people, their fibroids are picked up just because they are having scan, and it doesn't disturb them at all. Some of them, it does cause problems. And what are the problems? Firstly, it can make people's period quite heavy. It can make people not get pregnant. It can make people have constipation and wanting to use the bathroom a lot, as in wanting to go and urinate all the time. It can make people look pregnant as well. You know, if you see sometimes in our culture, in our community, they will say, oh, this woman has been pregnant for 4 years. A lot of the time, it might just be that she has fibroids or ovarian cyst. Now, other symptoms are it can cause swelling of the legs because it's compressing on the blood supply it's compressing on blood coming up from the legs to the rest of the body. And sometimes it causes something called blood clots, which is DVT. Because the movement of blood from the leg is not as good, so people start forming clots in the blood vessel, and that can be quite dangerous and can kill people. But most importantly, it's very important to know that a lot of people that have fibroid, it does not affect them at all, and lots of them do not need to intervene at all. So my talk today, or what I've been asked to talk about, is what are the myths surrounding fibroid, especially with fertility. There's been a lot of research with fibroid, and there's been a lot of discussions around it, and it's something that in a lot of the medical society we still discuss every day. For example, why do some people have fibroid and some people don't have it? Why do some people have aggressive fibroid and some people don't have it? Why do we need to remove fibroids at all? Why does it cause miscarriage and infertility in some people and it doesn't cause in some other people? I think there will always be continuous research about fibroid. Where, in the next 100 years, there will continue to be research. Most recently, there was a research that came out of America which shows that there's a gene that can identify who will have fibroid. So maybe in the future, when you are running tests, maybe like your routine screening test at a young age, you might want to do a gene test for fibroid, and if you have it, in those periods, they can actually do something called gene therapy, where you can change genes, and but that's futuristic. But we hope that it will happen in the future. So prevention will be better than cure in that case. So now let's focus on fibroid and infertility. Do fibroids cause fertility issues? The answer is yes, but it can also be no. So the first thing is that what type of fibroid do you have? What type of size of fibroid? What is the location of the fibroid? Those are the things that you need. So if somebody comes to me and say that, can I have fibroid? Can it cause fertility issues? The question is that I will tell the person, I don't know, until I can classify your fibroid, not necessarily based on size, based on location. Because you can have fibroids that are as big as a football, and it has nothing to do with fertility at all because of its location. But you can also have a fibroid that's the size of an egg, and that can cause people not to get pregnant. So, so this advice with fibroids is very individualized. So if a patient comes to me, the first thing is that I want to do a scan, an ultrasound scan of their pelvis to determine what type of fibroids they have. So when I say type of fibroid, so the first thing is that fibroids the wall, or if you think about the wall of the womb, just think about any wall. So you have the inside of the wall, you have the outside of the wall, and then you have the inside. If you think about blocks, that's the inside of the wall. But you can think about outside, the other side, or inside here. For example, if I choose this room, so where I'm sat in is the inside of the room. If I open the door and go out, that's the outside of the room. And within the wall of the room, there's a space as well. So it's the same for fibroid. So the one that we know absolutely affect fertility or pregnancy is the one that sits inside the room or inside the womb. So basically, it's almost like it's a tenant, comes inside and occupies the place, and nobody else has possession anymore. So it's like, I've become the landlord now. So the sperm or the fertilized egg cannot come. And it also changes the dynamics inside there. So technically, the womb feels that there's something in there, so cannot get pregnant, cannot allow anything else to come in because there's something there already. So most of those people, depending on how they are presenting, because those are the people that can present with heavy periods as well. So those people definitely needs to have the fibroid removed. Now, some people will say, oh, well, I'm not trying to get pregnant now. Can I leave it for some time and when I want to get pregnant? One of the problems with fibroid is that fibroids are not stationary in size. They will keep on growing. And the complexity of treating them is different at different stages. So how I will remove a small one will be different to how I will remove a big one. So my advice is that if you have a small one that is going to eventually affect you fertility-wise, I will probably advise you to remove it. But there's lots of my colleagues that probably are advising people, maybe not in the right way, that will say, leave it until you want to start having children. The problem with that is that, like I said, the fibroids grow aggressively and it becomes a bit more complex. Now, luckily for us, a lot of the gynecologists in Nigeria are very good at treating fibroid or doing fibroid surgery. If you go outside Nigeria or maybe in the developed countries, like Caucasian countries, sometimes they're not very good. And the fibers that we will remove here and not remove the womb, they will tell the woman that one of the options is removing the womb. Now, those are the challenges. And nowadays, we're starting to see inflow of women, probably of African origin, that are living overseas, coming back to Nigeria to do their surgery. They're not based here. They come to Nigeria to do their surgery here, spend some time here, and go back because they understand that concept. And maybe a lot of people are not bringing that into focus, but that's almost like a medical tourism because a lot of people are coming to do surgeries here. So that's with the fibroid inside the womb. So it's called submucosal fibroid. Submucosal fibroid. Now the one outside, when I was talking about the room, I said there's one, when you open the door and go outside, there's one attached to the womb outside. Those ones are called subserosal fibroid. They have nothing to do with fertility. You might have them as big as possible, but they're attachments because they're not affecting where the baby will stay or where pregnancy happens. So in those cases, somebody can decide that, okay, this is the kind of fibroid I have. I don't want to remove it for fertility reason, which is fair enough. But they do have their own problem. So one of their problems is that they can grow quite big and make the person look pregnant. Now the challenges with that is that even when they get pregnant, sometimes those kind of fibroids can go through some changes, which we call red degeneration, meaning that they are heavily filled with blood supply. And suddenly, so the dynamics is that blood can enter the fibroid and come back out. So with red degeneration, the blood goes in and then the entry point is blocked and all those blood is filled into the fibroid. And because it's filled in there, it's swollen and cause severe pain. So a lot of people get severe pain in pregnancy because of those kind of fibroid. Some people don't, but some people do. I've had a few instances where people like that go through pregnancy and they get admitted like 4 or 5 times with severe pain. And they come out of the pregnancy, haven't had vaginal deliveries sometimes, and they come and say, doctor, I cannot go through that process again. I would rather I remove my fibroid before I attempt to get pregnant again. So they're not necessarily seeking care because of the fibroid affecting their fertility, but they're seeking care because of the effects of the fibroid on their pregnancy. It doesn't cause miscarriage, it just causes severe pain that they need admission and strong painkillers for a long period. So that's another type of fibroid. The last type of fibroid is called the intramural fibroid. That's the one inside the wall. So there's still a few research about that, which means that it's inside the wall, it's not pushing into the cavity. So those types do not necessarily affect pregnancy. But the way we look at it sometimes is that, for example, if we have a couple, we've investigated them, there's nothing else affecting their fertility, and you see such kind of fibroid, you can discuss with the person and say, well, according to research, any type of this type of fibroid, the intramural fibroid, that is more than 4 centimeters has been shown that it can affect your fertility. But in those instances, I'm actually open to the woman trying to conceive by themselves, because if they do that, then we don't need to do any form of surgery. Remember, surgery is fine, but surgery has its own issues as well. So if you can avoid surgery, it's better. But if you need to do surgery, then it's important. So the intramural fibroids they can affect fertility or they can prevent you from getting pregnant, but a lot of people also get pregnant with them because of the size and if it's not pushing into where the baby is meant to stay. So I think the summary of this is that the fibroid that affects fertility depends on the size and also the location. Now, it's also, I think one of the things I've learned as a doctor is that you must never say that, you cannot tell a woman that, oh, this fibroid, you will never get pregnant with it. I think once you have given those kind of advice and somebody has come back and say, doctor, but you said I can't get pregnant, this is my pregnancy, then you need to be very careful. I think it's better to be more professional and say, well, the kind of fibroids I see in you, in most of my patients that have this kind of fibroid, they usually don't get pregnant. But don't put never into it, because even if a woman say, doctor, thank you, you've told me that I need to remove this, but I'm not ready. You still have to support them. You can say, well, yes, I said that. You can, if you want to continue trying, it's okay. I will see you again in 6 months. Maybe your views might be different then. I mean, one of the things you don't want to do is coerce people and tell them that you must remove it, you must do that. Because, in as much as I'm a faith person, I'm not God. God has a way of, I know that there's some challenges between God and science, but I still believe that I'm not the creator of this person. And if the creator says this is going to happen, it will happen. But most of the time, I have to use science to advise people. And I'm using science based on research, which shows that in this type of people, 9 out of 10 times they will not get pregnant. One time, maybe. But even if they get pregnant, it might end up as miscarriage. So why don't we even remove it? And I've seen so many times that happen in South Shore here, where we have ended up removing fibroid and people have gotten pregnant. Interestingly, let's say today, I ran a clinic today. I've seen 2 people. The first one is a lady, I remove her fibroid through hysteroscopy, through the camera that goes inside the womb. We didn't have to cut her about 6 years ago. She came to see me today. She was having issues. But after we removed that fibroid, she went through IVF and got pregnant. So she has a son. And she was telling me that she just adopted another girl because she wanted to, but she didn't want to go through pregnancy again. I also saw a lady today who lives in Canada, who, after she got pregnant and had a baby last year, because of the severe pain that she had during that pregnancy, we did a fibroid surgery for her in, I think it was September last year. And we did the keyhole. We didn't cut her open, we did the keyhole. And she came today for a checkup. She just came back from Canada and spending some time in Nigeria. So I saw her today. So we see diverse people, and we see people for different reasons. So fibroid do definitely cause fertility issues, but your doctor needs to determine what type of fibroid you have. So when I see people, I either scan them. If I need more information, I get something called MRI. An MRI gives me a lot more information than scan. And then I use that to advise them about the treatment options. So, and also I think a lot of people worry about removing fibroid because of stories they've heard. Somebody died because of fibroid surgery, somebody did this, somebody that. I think one of the things about surgery is that without mincing my words, surgery has risk. The risk can be bleeding, especially with fibroid, it can be bleeding, infection, an aesthetic problem. But if you go to a center where they are well tested in what they do, they have processes that is safe, then it's unlikely for that to happen. I think unfortunately in Nigeria, fibroid surgery is not as regulated. So as a gynecologist, which I am, so I finished medical school and then start a program, a training program, teaching me about how to become a gynecologist. Some of us will do that for 5 years. Some of us, like me, did it for like 10 years. And then you have experience. In your training, treating fibroid will be part of that training. So you've been well thought. And all the risk, prevention of risk has been put into your syllabus. You would have trained with a senior person as well. You would have done a lot of surgery with a senior person. And then when you are ready to become an independent doctor, because of the training that you've received, it's almost like saying that you receive freedom. but we don't do all those parties, that they do for freedom. You receive freedom and you're ready to practice. So you now start practicing. Now, unfortunately in Nigeria, we have people that do not go through all that. They may have set up a hospital, because I'm sure you know the hospital is very easy to set up in this part of the world. And because they've assisted or they have assisted a gynecologist for some time, they feel that they can do surgeries. Or I've even heard people that are not gynecologists removing fibroid. They are either general surgeon, which is fine. A surgeon means that you can do surgery. But if you're not trained about reproductive surgery, that means doing surgery and conserving the womb so that this person can have children, then you might do something wrong. So if you are unlucky to have gone through that process, then we will hear all this issue about complication with fibroid and stuff like that. Now, in the future, there's going to be there are a lot of research going on about not doing fibroid surgery, as in other treatment for fibroid that does not include fibroid surgery. There's still a lot of hesitation with it, and I feel particularly strong about that, because I believe that the gold standard for removing fibroid is surgery. You cannot remove that. Now, yes, there can be additional new techniques that can help with that, but the effect of it on fertility, on pregnancy, is what we're not 100% sure about. And so we need to tread that journey very carefully. But if you are going to do a treatment, and the one that we know that has been tested so and proven is fibroid surgery in a good center. And if we look at it, places like England, America, China, Japan, Germany, Italy, they're still doing a lot of fibroid surgery. So fibroid surgery will never become obsolete, but it's also important that people are given the option and given the risk and benefit unbiased. I think sometimes as doctors, when we advise people, we're biased about our decision, about our advice. We advise people according to what we can do, rather than advise them according to all the information and let them make decision. And if the decision is what we can do, we can definitely direct them to where they can do that. Now, I think I've addressed most of the myth around fibroid. And I've also kind of tried to address the myth around the treatment of fibroid as well. Because a lot of people think, I think the common thing I see with a lot of people that come for fibroid surgery is that they're so scared because they've heard somebody died and this. And I'm always, there's a feeling I get the morning after the surgery when I go and speak with them. I can see this relief in their face, as in, oh, I didn't die, But having done this so many times, I know that that's a myth. I think as a surgeon, you have to know your limits. You have to know when to do surgery. You have to know when not to do surgery. I think that's very important. Not everybody you will need to offer them surgery. Some people, surgery will be dangerous for them, so you need to know how to find that. You need to also know that sometimes it is not only you that will do the surgery. You will need other specialists to be part of your surgery, particularly somebody called the bowel surgeon, because if somebody has had surgery before on their tummy and they are coming for fibroid surgery, it's almost likely that they will have something called adhesions. And adhesions can get stuck to it means that their bowel is stuck to the fibroid, and you need to be able to separate that without damaging the bowel. So you want to go into the surgery with a bowel specialist. You don't want to go by yourself and then find there is a problem and start looking for a bowel specialist. I think it's important. That's what we do here. We always do like a joint surgery with a bowel specialist if we determine that there's risk like that. And I'm happy to say that we have a very, very excellent safety record with fibroid surgery. I think I can say that the fibroid surgery we've done here is probably close to 2,000, and I'm happy to say that it's safe. It's a safe surgery, and but surgery, like I said, is not for everybody. Because you have fibroid doesn't mean that you cannot get pregnant. But what you need to do is you need to go to a specialist, not only a specialist that knows how to identify such fibroid. I think in most part of the world, they have something called fibroid clinics, where there's one person or a couple of people dedicated to seeing people with fibroid. And I'm sure you understand that once you see a lot of fibroid, you almost become like an expert, or you treat that. The challenge in Nigeria with that is that it's almost every gynecologist do the traditional fibroid surgery, which is the open surgery, but not everybody do the other surgery. But I think it will be a challenge for me as a gynecologist to be in Yola, where I can offer this woman open surgery, although there might be other surgeries that are beneficial or are probably better than that open surgery. For me to now refer them to Lagos to go and do laparoscopic surgery, sometimes it doesn't make sense. The main thing is to help that person in Yola develop their skill so that they can still continue to do the open surgery, but at times when that woman doesn't need the open surgery, they can do other type of surgery for that fibroid. So yes, fibroids do affect fertility. If your doctor says that your fibroid is affecting your fertility, you can do one or two things. You can either go ahead and do the surgery after you've done your due diligence with respect to the doctor and the hospital, or you can seek another opinion in a center where, the good thing about life now is that anything you want, you can go on the internet and search and type in fibroid specialist or something like that. You will find somebody irrespective of where you are in the world to help with that. So I think with that, I think I have over extensively talked about fibroids, myth and challenges with regards to fertility issues. Thank you very much.
Concerning fibroid, is there any other way to get rid of fibroid other than surgery, open surgery or even the small surgery? For some of us that we watch a lot of films and futuristic films, I've seen where they can just use laser and the thing will just melt. For our traditionalists, they'll say, there's this concoction you can drink, and many people have tried a lot of things to get rid of fibroid without surgery. They are hoping that one melt the entire thing out of their body. But the question is for you, Dr. Olajuwon Alabi, and it is to confirm if there are other safe ways to get rid of fibroid other than open surgery.
Okay, thank you very much. Can you hear me?
Yes, we can. Yes, we can.
Okay, so I think in my talk, I did mention some things about, so there's surgery, and surgery can be divided into many parts, whether it's the traditional one that everybody does, which is called open surgery, or minimally invasive surgery, which we do quite a lot, which is called laparoscopy or hysteroscopy, where you just go inside the womb and remove the one inside the womb. Nowadays, there are even more options for treating fibroid. There's something called fibroid embolization, where you just identify the fibroids and block the blood supply to the fibroids. And a more recent one called HIFU, where you use ultrasound heat to destroy fibroid. But in the scope of this meeting, which is fertility, one of the challenges with any option is to think about the fertility need of that person. And I think, yes, surgery has its own issue. And if the fibroid surgery sometimes can cause fertility issues if it's not done properly or as a result of the complication. But most of the other options can prevent women from having children as well. So I think first thing is that it depends on what your fibroid is. It depends on the location. It depends on whether you want to still have children or not. For example, embolization, a lot of people would advise women maybe not to do embolization if they're still trying to conceive, although that is a I think it's a patient by patient basis. The reason being that that procedure sometimes can affect the ovary and reduce the ovarian reserve. So you might want to not do surgery to prevent you or to improve your chance of getting pregnant and not have all the issues with surgery, but you end up killing all your eggs. So that's the issue with that. The other one is HIFU. HIFU is a technique which is currently available in Nigeria, but is, in my own view, has not been well tested enough in blacks. I think it's something that's coming out of Asia, which is China, but it's not really, I think they've not really done the proper research to know the effectiveness of it and also the safety aspect in getting pregnant. So I think I will be a bit reluctant to use that. So I think my focus will still be, okay, the one that's been well tested, that if done properly, you're able to achieve pregnancy. I mean, you got to remember that in the entire world, there are millions of fibroid surgery that have been done, you know. I mean, there was a woman who I delivered this week who initially did a fibroid surgery and has had 2 cesareans, or I think, yeah, has had 2 cesarean, no, three, these are 3rd cesarean after that. So, like I said, it's a myth that when you do fibroid surgery, it's dangerous, it affects you, as long as you do it in the right place. That's the most important thing. But it's a technique that is not going to disappear. You might end up going and trying all the other methods, but you might come back to it. But most importantly, you just need somebody that can advise you properly from the onset. What kind of fibroid do I have? Can it affect my fertility needs? Do I even need to treat it at all? If I need to treat it, can I use what kind of treatment do I need? What we know is that there's no medicine that treats fibroid. All the herbs that we hear doesn't, because we end up seeing a lot of people coming back and having surgery. Sometimes it's even more complicated. Sometimes it even damages their kidney when they go and use, all this traditional medicine. So please, what I will advise is stick to things that have been well tried and tested. Do your own research as well. Unlike Nigeria, unlike most developed worlds, where you have to have gone through a process of certification by a government ministry to approve a treatment before it's rolled out. For example, if you look at America, they have the FDA. You cannot just come into a country and introduce a treatment. It has to have gone through proper checks. But unfortunately, in Nigeria, we don't have that. We can suddenly wake up and say, oh, there's this test done here. Let's bring it and start doing it. But so I hope that we get to that point where we only stick to what has been well tested, what has been proven. And also, when you bring a treatment in, you have to declare all the things associated with that. And you have to have tested it in your population. You can't use something that's been used in China to be treating Black people. We're totally different. And so our fibroids are different as well. Thank you.
Thank you so much, sir. Thank you. The interesting part about the concussion stories, because they are all over social media space, people promising that they will take a drink and it will melt your fibroids. So I'm happy that you highlighted the fact that in most cases, yeah, it might seem like it works temporarily, giving you relief, but there are also the other side of the challenge being that people might end up having kidney issues from taking things that you don't really know what you're taking.
Let me give you an interesting story. So one day I saw in the papers, a national paper, we treat fibroid with no surgery. And there was a phone number. So I called the phone number I called it and said, oh, Oga, I want to come and treat fibroid. The guy picked up the phone. He said, no, sorry, I'm in the bus. I will call you back. And I'm thinking, okay, so this person, with all due respect, I think that our country is very spectacular. People get away with a lot of rubbish. And it's also one of the problems is the fear. People are so afraid of surgery that they will do any other thing. I mean, I always say this in any of my talk. I have treated a woman before who is a MBA, she has master's, so she's well educated, was taken to somebody who put a stuff in her vagina because they think the fibroid will melt. And obviously that destroyed her vagina completely, blocked it off completely. So I think in terms of, please, let's stick to things that are proven, professional, scientific things, not all these local things, unfortunately. Thank you.
I would be taking the question back to Dr. Olajuwon Alabi, and this question is concerning, yes, fertility. If I know that you mentioned, you alluded to this question earlier, but not directly. So the person is asking that the person has a fibroid. It is not inside the womb. It is outside the womb, but it is so big that she looks pregnant without being pregnant. And people are asking her, when is she going to give birth? When is she going to give birth? And though it does not, they say it won't affect her getting pregnant, but she just feels very uncomfortable, but she hasn't had a child. Would you advise such a person to take out the fibroid, or what would you advise her to do?
Okay. So, sorry, so can you hear me? Yeah?
Yes, we can hear you.
So the first thing is that it's always very difficult to advise people when you don't have the clear facts. So the first thing is that if you're saying that you have a fibroid that's making you look extremely pregnant, but it's not, because sometimes people interpret, so if you go and see a doctor, sometimes the information you take from the doctor is not necessarily the real one. And that's why some people will expect a doctor to write a letter or a summary of what they discuss when they leave. So for you to have a fibroid that's big enough to show that you're pregnant, if it doesn't affect you from getting pregnant, it will definitely affect you when you're pregnant. So it depends on how, but I don't have the full facts. So my take is, it's unlikely that this fibroid is not going to affect you if it's big enough for it to make you look pregnant. I haven't said that. I've looked after people that their fibroid are massive and they get pregnant. And I kind of understand the challenges. It's just a totally difficult pregnancy that you might even lose the baby. So why do you want to put yourself through that? I think, unfortunately, you have to pray about it. Pray to God to lead you where you can get good care. But I think a situation like that, I'm afraid you would need some kind of intervention before you get pregnant. So I believe that you will need some treatment. So I think, but difficulties that I don't have the full details. I don't have the picture. I don't have anything. So it's very difficult for me to, but I think it's unlikely that it won't affect you.
By the way, I hope it's okay. Can you hear me?
Yes.
Okay. By the way, I just want to say something about Dr. Olajuwon. I mean, he didn't send me, and this is not like an advert. I'm speaking because I've actually had a session, a procedure in his clinic, right? And since that day, I think this was about 2018, if I'm not mistaken, or 2017, I can't remember precisely when. I've been referring people to that clinic, South Shore Women's and Children's Clinic. Then it used to be of only women, but now it has added children's clinic to it. The experience I had was like synonymous to what you will have in the UK or US, because the truth of the matter is, what kills people is not the surgery itself. It's not the surgery. My sister also happened to do the surgery, because when my sister had fibroid, I made sure, look, of course it doesn't come cheap. Good things don't come cheap, right? I made sure that my sister did the surgery there. And my office is close to Dr. Olajuwon's hospital. I remember one day I went to check my sister. I was so happy. Because it's the post-care, post-surgery care that kills people. Because people the people are not taking, they're not monitoring, they're not checking, I mean, I'm not a doctor, but I mean, there's a level of care or negligence that you can do that the patients can die even after a successful surgery. So please, is surgery, fibroid surgery, I've done one too. Fibroid surgery is not something that we should be afraid of. Just make sure you get the right counsel. And if you're in Quiverfull, we always ensure that we go to the right places. Don't shortchange your life because you hear, oh, it's 1.2 million, it's 1.5 million. Then you go to a place where they say it's 500 naira, and they cutler as if they use. I see some scars, women's scars, and I'm like, was it a carpenter that did this surgery? So please, as much as we want to get pregnant, we want to have babies, we don't want to die. Don't die before your time. Make sure you get help. If you need to solicit help from your family members, all those people praying for you, after they have prayed, let them put money in the prayer. Put money down. Okay, it's 1.5. How much can you give me? 200K. Take. Go to a reputable hospital where you're sure that after the successful surgery is done, your post-surgery treatment is also intact. Thank you.
Just to add to that, I think one of the things that people think is that, oh, if I leave this fibroid, it will disappear. It's not going to disappear. It will get bigger, and then the surgery that you will eventually do will get more complex. I think you have to always remember that. Fibroids grow every month, every day. It keeps growing. Wow. And then by the time, so if it's 5 centimeter on January 2020, by the time it gets to January 2023, it will be like 10 centimeters or even more. So it grows. And I think people need to understand that. Thank you.
Thank you for joining us for Fertility Conference 2023. We hope to see you next time.